Good morning, everybody, and thank you for joining us. I am Olayemi Jurutoyi, pediatric consultant, and in conjunction with the El Gracia Child's Foundation, Ogun State. This morning, I'll be talking about sickle cell disorders. Sickle cell is a well known condition to most of us, and I can assume or I can say that many of us would have come across with someone, either a child or an adult, who has sickle cell, either in the church or at home or in school or somewhere around us. We would have come across someone who has sickle cell disease because it's a common condition in Nigeria and West Africa and in other parts of the world where there is a lot of black population. When people hear about sickle cell, what they think about is people who always fall sick all the time and are always in the hospital. And they are usually remembered mostly for when they are sick and they have one crisis or the other. But today I'll try to shed some light on what sickle cell disorders are, coning down especially on sickle cell anemia, and then telling us how this disease can be prevented. And those who already have it, what can they do? How can they carry on to live a long and very productive life? So, that's by way of background. Let me delve into the matter. Sickle cell disorders are a group of, let me say, an heterogeneous condition in which people have abnormally shaped hemoglobin. What is hemoglobin? Hemoglobin is the portion of our red blood cells that carries oxygen to every part of the body. So people who have sickle cell disorders, their bodies produce abnormal types of hemoglobin. This is different from sickle cell anemia. I must make that distinction. Sickle cell disorders different from sickle cell anemia in that people who have sickle cell disorders have abnormal hemoglobins coexisting with other types of hemoglobin. So what I mean is that people who have sickle cell trait, that is the hemoglobin that we call A plus S. Some people have hemoglobin A plus C. Some people have hemoglobin A plus D. They are the hemoglobin, different types of hemoglobins coexisting with the hemoglobin A is what constitutes sickle cell disorders. But in sickle cell anemia, the person has the two types of hemoglobin that are produced are S. So, and what happens is that in sickle cell disorders, the person has a genetic condition. The person is born with this condition. And what happens is that there is a mutation in the proteins that are supposed to produce the normal type of hemoglobin. But then, because of that mutation, the person produces abnormal hemoglobins which cannot effectively carry oxygen to every part of the body. So, sickle cell disorder is abnormal type of hemoglobin coexisting with the normal type of hemoglobin, or what we refer to as sickle cell trait in some people, while sickle cell anemia is when the person is homozygous S. That is, the hemoglobin produced is S and the other one is also S. So, let me talk a little about epidemiology. Like I said earlier, sickle cell disorders are common, very, very common in the black population, not only in Africa, but in other parts of the world where you have a large group of black people living together. And the reason is because there is a situation which we refer to as balanced polymorphism, in which you have one condition which is seen as an adverse condition, but that condition protects you against another type of disease. So the presence of this sickle cell disorder or the S type of hemoglobin protects us Africans. It's supposed to be protective against severe forms of malaria. So we live with it in a balanced form, malaria on one side, and then the sickle cell condition on the other. Now, let me talk about the genetics of sickle cell disorder. What happens is that when a child is born, it inherits some genes from the mother and some from the father. So, in the case of this hemoglobin, The normal hemoglobin that the regular population have is the hemoglobin A. That's why when we go for genotype testing, we say this person is AA or this person is A and something. So the normal hemoglobin is the hemoglobin A, which carries oxygen round every part of the body. But in people with sickle cell disorders, they have a genetic mutation which make them to produce another type of hemoglobin which is different from that A. And this type of hemoglobin is not effective in carrying oxygen round the body. So people with sickle cell traits, that is A plus S, A plus C, A plus D, they have abnormal types of hemoglobin. So I won't really be talking so much about those ones. Now let me come down on sickle cell anemia itself. Sickle cell anemia. What happens in sickle cell anemia is that the person has inherited the gene to produce the abnormal hemoglobin S. One gene from one parent, maybe the father, and the other gene from the mother. So when the person is born, genetically, the person is born with the bone marrow producing this abnormal type of hemoglobin, which is SS. So it's a long life condition. It's a genetic condition, like I've said. It is not a condition that you can go over the counter, take a drug, and then it is cured. People who are born with hemoglobin S live good lives, but their lives are punctuated with several hospital visits, several crises, and some of them even have complications arising from this hemoglobin S. Now, in the normal hemoglobin, when you take in oxygen from your lungs, the oxygen attaches to this hemoglobin and it goes around every part of the body. And then um, it attaches on the red blood cells, and the red blood cells actually carry them around the body. But in people who have sickle cell anemia, their own kind of hemoglobin, um, oxygen cannot really stay on it for a long time. And so that causes the red blood cell to change its shape from the normal ring shape to a sickle shape. A sickle is an instrument that is used to harvest rice, is C-shaped like that, like you can see in the pictures that are accompanying the presentation. So what happens is that these sickled shaped cells, they cannot easily pass through the blood vessels of the body. And like I said before, you need those red blood cells to carry oxygen and other essential nutrients to every part of the body. So that is the genesis, and in fact, the genesis and the borrow me the English. That is the cause. That is the cause of the problem in sickle cell anemia. So for normal people, the red blood cells are ring shaped. They can pass through the blood vessels without any problem. But in people who have sickle cell anemia, their red blood cells, they assume this sickle shape when maybe they are under some low oxygen tension, or when there's an infection, or there's a production of a lot of inflammatory markers. They change their shape to this sickle shape, and they are not able to pass through the body. And then because these cells are abnormally shaped, the body sees them as, misproduced red blood cells. So the body starts to break them down. And so that's what causes the anemia in them. Even when they are not sick, if they don't have, even when they don't have any problem, the body constantly breaks down these abnormally shaped red blood cells, so they are always in a constant state of anemia. So let me talk about the different type of crisis that sickle cell anemia brings to the patient. And what I mean by this is that many of us are familiar with sickle cell patients when they have crises. Oh, they're always sick, they're always going to the hospital, blood transfusions all the time. All this are what happens when they have what we call a sickle cell crisis. And they are divided mostly, generally, into four parts. The first and the most common one that many of us will be familiar with is the bone pain crisis. And what happens in the bone pain crisis is that the red blood cells they assume this sickle shape, they block the very small blood vessels of the body. And so, because of that, blood cannot pass through to anywhere that is blocked. Blood will not be able to flow to the distal areas. And so, that causes a lot of pain, a lot of excruciating pain. That's what we call a vaso-occlusive crisis in sickle cell patients. The next kind of crisis is what we call the acute sequestration crisis. And what happens in this case is that the large organs of the body, like the liver and the spleen, that have a rich blood supply or a rich network of vessels. Sometimes when they get blocked, blood can flow into them. But when the sickle cells, when they block the blood vessels, the blood is not able to flow out. So most of the patient's blood is pooled either in the liver or in the spleen. And then all of a sudden, a child or maybe a young adult who has sickle cell, who has been fine, carrying on well with all the activities, suddenly becomes very, very pale. And then they have to be rushed to the hospital. Another kind of crisis is the acute hemolytic crisis. And what happens in this kind of situation is that due to an infection, usually by the parvovirus B19. That's the most common organism that causes the acute hemolytic crisis. But in some children or even young adults, we've seen some of them who do not even have this virus, but also have a general, bacteremia or a bacterial infection. Their red blood cells goes into breakdown, starts to break down almost all the red blood cells. The patient becomes very pale, they pass very dark colored urine, and their eyes become very yellow. In that kind of situation, that is acute hemolytic crisis. I've spoken about the acute bone pain crisis or the vaso-occlusive crisis. I've talked about the sequestration crisis. Now I'm going to talk about the aplastic crisis. What happens in the aplastic crisis is that the most times the patients are infected with the parvovirus B19 infection, and this goes straight to the bone marrow, depresses the bone marrow, and so the patient is not able to produce red blood cells. Also, we have the hyperhemolytic crisis, in which, due to one infection or the other, the patient's red blood cells start to break down to the point that the patient has to be rushed to the hospital for a life-saving blood transfusion. But of all this, the most common type of crisis that sickle cell patients are known for is the bone pain crisis. The bone pains usually very excruciating, and many sickle cell patients have to be on very strong painkillers to be able to overcome these episodes. So, what I would like to talk about now is, how do we prevent sickle cell from Nigeria? If you must know, has the highest number of people living with sickle cell anemia in the whole world. 1 out of every 4 Nigerians is either carrying the sickle cell trait or have sickle cell anemia. And just in spite of all the awareness and all the talk that has been going on for many years about sickle cell anemia, I still see a lot of newly diagnosed cases of sickle cell anemia. And the way to prevent it is by people who carry the sickle cell trait. That is, people who are A plus S, or people who carry A plus C should not have children with people who also carry the sickle cell trait. That's the best way to prevent more people from being born with sickle cell anemia. There are different methods by which people who have this kind of condition, sickle cell trait, when they get married, they can go for some genetic testing or genetic counseling before they have children. So that is one major way of preventing sickle cell anemia. So you want to ask me, if somebody is newly diagnosed with sickle cell anemia, or people that are living with sickle cell anemia, how can we help them? What can we do for them to live a better life? Okay, so let's start from the beginning. First of all, for parents, because I'm a pediatrician, for parents, many of them are in denial. they do not even accept the diagnosis. And so here is a child before you who has all the features and who even has the symptoms and even the signs of sickle cell anemia, but the parents are in denial. They are refused to accept the diagnosis. The first thing is to, first of all, counsel the parents, counsel the patients, talk to them, let them know that sickle cell anemia is not a death sentence. It used to be, but it is no longer a death sentence. People with sickle cell anemia can live very long, productive. Like I have friends who are doctors, bankers, engineers, even celebrities in Nigeria who have sickle cell anemia and they are living a very good life. All that we need to do is to stick by the instructions and then prevent infections, prevent malaria, and then you are able to live a good life. So I'll go through these steps one after the other for the benefit of everyone listening to me. So after accepting the diagnosis, what do we do? The first thing to do is to make sure that the patient, it may be a child, you need to also speak with the patient to make them know, because I see a lot of young people, a lot of young adults with sickle cell, they have low self-esteem, they have depression, they are wondering, oh, how did this kind of life happen to me? You also need to speak with the patient to encourage them, to make sure that they don't have psychological issues that may affect even their mental health. So for the children, um, they need to take their medication, their routine medications, which we give to children, which is folic acid, is the first one. And what folic acid does is that it helps to produce new, it helps the bone marrow to produce new red blood cells. The second routine medication we give is paludrin, which is taken, these are taken every day. And what paludrin does is for malaria prevention, because malaria is one of the worst enemies of any patient living either with the sickle cell trait or even sickle cell anemia, because malaria will destroy um, the red blood cells. And so this is somebody who does not, in the first place, have enough red blood cells. So malaria is a strong enemy of anybody living with sickle cell trait or with sickle cell anemia. So we give folic acid and paludrin, folic acid to encourage the bone marrow to produce more cells, and then paludrin to prevent malaria. Also, children with sickle cell need to take special vaccines. And what I mean by special vaccines is that because of all the issues that are going on with the immune system, and then for children who have had recurrent splenic sequestration crisis, they may undergo what is called an autosplenectomy. And what happens in this kind of situation is that the spleen starts to lose its function. And so the immune function which the spleen plays in the body, it cannot subserve that function adequately. So these children need to be vaccinated, to take special vaccines to prevent them against some certain kind of organisms which may infect them and actually bring down their health. So the other thing to do is that children with sickle cell anemia must drink a lot of water. And the reason is not far-fetched, it's just because they need that water to make the blood to flow smoothly in all their blood vessels. And even in places where the blood vessels may be blocked, the water will help to make the blood vessels flow. So we also need to look at stroke prevention in children with sickle cell anemia. And the reason is because just the same way as I've described that the sickle cells can block the blood vessels in the body, they can also block the blood vessels in the brain, leading to a stroke. In fact, strokes usually do not happen in children, except not usually do not happen in children, but usually occurs in children who have sickle cell anemia. So stroke prevention is very important. Any child with sickle cell anemia must undergo a transcranial Doppler, which is like a form of ultrasound to check the blood vessels of the brain to see how the blood is flowing. And then we are able to predict a tendency of the child to have a stroke. And if the child falls into the criteria, there are medications that the child can take to prevent the child from having a stroke. Hygiene, good hydration. They must avoid excessive play, and then they must be on a balanced nutrition. The reason is because the red blood cells are being broken down constantly. The body is in a state of overdrive. So, somebody who has sickle cell anemia must have adequate nutrition at all times to make sure that all the red blood cells that are being broken down and how all the organs are being overworked, they are able to replenish with lots and lots of nutrients. Sickle cell anemia is very common in our society, and so for anyone who has sickle cell anemia and has a crisis, you need to go to the hospital. Some for day-to-day management, after going through all of these things, you take your routine drugs, you've taken your special vaccines, you are good hydration, good nutrition, a balanced diet, but then this crisis will still come. I would advise that you go to your nearest healthcare facility where such a patient can be attended to. And I usually say that anybody with sickle cell, a you must have a healthcare facility you are linked to that you can always visit at any time. My time is fast spent now. I may not have been able to touch on every aspect of sickle cell anemia, but there's always room for questions and comments. You can always send us questions, or you can send in your comments in our comment section. And I must say at this point, thank you very much for listening to this program. Till next time, when I come your way again, Olayemi Drew to a pediatric consultant. Thank you.